Hey guys, Dr. Brodsky here. Welcome to your second trimester. If you haven't already checked out the first trimester video, do that when you get a chance. In the second trimester, this includes weeks 12 to 28 of gestation. So there's a lot going on. It's a really exciting trimester. This is usually when you have your honeymoon and you feel a whole lot better during this trimester. You have more energy and everything. Things to expect during this time are, like I mentioned, getting to take less naps, having more energy, getting a cute little bump on your belly that people may start to notice. You may also increase urinary frequency around this time because your uterus is growing. By 28 weeks, it's well above your belly button, so you may notice that that puts a lot of pressure on your bladder and you have to get up a couple times a night to go pee. That's completely normal. Just make sure you're leaving your sample at your doctor's office every time to check for infection. Other normal stuff around this trimester is feeling like you're having more low back pain, and usually you can use a heating pad, or you can even have your partner give you a little massage and that'll help too. A warm bath can help with low back pain too. I routinely recommend prenatal yoga to my patients because that absolutely helps with ligaments and just musculoskeletal pain in general in pregnancy. You're also going to get to notice fetal movement during this pregnancy, which is super exciting. Anywhere between 16 and 20 weeks that can happen. And you may notice that you get more hair. It looks a little darker. You may notice it in parts of your body that you didn't have it before, like on your abdomen more or on your arms. And that's completely normal, along with increased coloration in your skin. So you may notice a dark line down the middle of your abdomen or even dark spots on your eyes. This is very common in pregnancy and nothing to worry about. But if you have any concerns, you can bring it up with your doctor. Also, you may notice that your skin is a little bit more itchy sometimes. Just avoid hot showers, take those colloidal oatmeal baths, and use hypoallergenic lotion. That'll definitely help. So things to expect with your doctor in the second trimester are a range of things. In the earlier second trimester, your doctor may complete your genetic screening and do a blood draw for spina bifida in their office. The other thing you can expect to happen is your doctor may tell you your baby's gender at this time. So usually between 18 and 20 weeks, we can tell that unless you get a blood test that tells you earlier. If you don't want to know the gender, that's always fun for us too. I personally never find out the gender unless my patients want me to know for some reason, but it's always a really fun celebration for all of us at the delivery if that happens. But aside from fetal gender, you're also going to get your anatomy ultrasound during this trimester. So 18 to 22 weeks, this is going to happen, and it's recommended for every pregnancy. So they're going to take a close look at your baby on the ultrasound and think of it like an examination of your baby. So bring people with you to that appointment who you would want at a medical exam for a family member. Because if something comes up and it's abnormal and it needs to be followed up on, that may not be information you want to share with everybody. Your anatomy ultrasound is also going to be a time where they look closely and measure the baby. This can also be done at a high-risk doctor's office if there's a reason to, and that's called a more detailed level 2 ultrasound. Anybody that's a high-risk pregnancy or over the age of 35 or have other issues or maybe even had abnormal screening goes to a perinatologist for their routine anatomy ultrasound. Around this time too, we do more dedicated ultrasounds of a baby's heart if we have concerns about that. Also, later in the second trimester, we're going to be doing your glucose testing. So you can talk with your doctor more about it, but basically you drink a sugary drink and then get your blood drawn an hour later. It's always good to do that on a morning appointment so it doesn't mess up your eating habits for the whole day. We also check your blood count with that and make sure that your antibody screen is also still negative. Other things you can expect in the second trimester are you're still going to see your doctor every 4 weeks, but make sure you're drinking enough water and your doctor's still going to go over your weight gain with you. So things to look out for are making sure that you're feeling regular fetal movement, look out for any bleeding or severe cramping, and you want to start thinking whether you want to do cord blood banking and ask your doctor any questions that you have about that. Also start thinking about doing prenatal classes, doing a tour at the hospital, and pre-registration. All those things are good to get a handle on early. That's it for the second trimester. Thank you so much for tuning in. Don't miss my other videos weekly and monthly with pregnancy, and you can always find me at drbrodsky.com.